Good morning, good afternoon, good evening. We are happy you are joining us wherever you are for this episode of Getting to Zero, the webcast from Sabin Vaccine Institute that lets you hear directly from public health leaders who are working towards zero preventable deaths through immunization and global health innovations. Today, I'm delighted to be speaking with Mridu Gupta, the Chief Executive Officer of Capid India, one of the organizations that is at the forefront of cervical cancer elimination in India, and a founding member of the global HPV Consortium that Sabin has been coordinating for the past 6 months. Mridu has 3 decades of public health leadership expertise and is passionate about collaborative models of partnership that create sustainable, lasting change. As Capid celebrates its 10-year anniversary, it is winning awards for developing programs that have reached more than 55 million people with awareness activities. It has helped screen more than 35,000 women for cervical cancer and supported almost 1,000 of these women to navigate treatment after they were tested positive. Mridu, welcome. And I'm so delighted to be speaking to you for this Getting to Zero episode.
Thank you, Anuradha. Thank you. Very happy to be here.
We often say that lived experiences of people can shape organizations and their work in profound ways. Mridu, can you tell us how did Capid India begin? And how did you come to focus on cervical cancer, then breast, and also oral?
Thank you for that. It's been a journey, Anuradha, but when we started in 2014, I had just lost my mother to lung cancer. So I lost her in 2013, and there was this need to do something about it. And it just so happened that in 2014, I met with other people who had lost their loved ones. Like Mr. Bharatram is our trustee. He'd lost his wife to breast cancer. Alok is another trustee. He'd lost his mother to ovarian cancer. So we were all, people who just had our brush with cancer. And when we came together, we knew we wanted to do something. But what did we want to do? Usually it was people were funding other cancer treatments and things like that. But we met with Dr. Ved, who was the doctor for Mr. Bharatram's wife, and he's one of our trustees, and he's with Medanta. So when we went to him for a discussion, he said, you must work on cervical cancer. None of us had really had a brush with cervical cancer. But he said that cervical cancer is a death that even we doctors find very wasteful. It's something that, we just feel if she had come in a little earlier, we could have saved her. So he's saying, do that for us. Go out there and tell people that cervical cancer can be avoided. And that's where we started. But there was just no conversation around cervical cancer. Nobody had heard about it. Nobody was talking about it. So we kind of started to create a pathway for cervical cancer. And when we started and we realized that we were being able to bring the women in and communicate, have them, we said, why not talk to them about breast cancer as well, because we have this captive audience. So after discussing it with doctors and with all our stakeholders, we started speaking about breast cancer. And once we moved to working with the government had already identified cervical, breast, and oral as part of their NCD. So they said, if you're bringing the women into all 3. So we have, eventually evolved to doing all 3 cancers. We started as a cervical cancer organization.
Lovely. So Capid recently won an award for its cervical cancer-free district model, Mridu. And I know that includes bringing screening camps to communities and then helping women navigate follow-up treatment. What really was the impetus for that idea? Are you satisfied and with and proud of what you have been able to achieve so far?
Am I proud of what my team has been able to do, what we have been able to do? Yes. But am I satisfied with it? Not yet. We have a long way to go. So no, I don't think it's an achievement as such. But yes, we have put that model together. So, like in research, you have this whole thing about no-do gap. that, we know about it, we have the research, but we don't know how to convert it to action. So it's a lot like that with policy. We have the policy, it exists, but it hasn't been converted into action. The beneficiaries of the policy are not getting their due, right? So even in India, we have policies around this, which is really very advanced. For them to have recognized that cancer screening needs to come to primary health care and to have put it into policy, we have it. We have operational guidelines. We have all of that. But the beneficiaries aren't getting that. It isn't reaching the people it's supposed to benefit. So that is the gap that we recognized. When we would want to go and work on policy change, they'd say, we're already doing this. It already exists. So we had to understand what was missing in this whole game plan. What was actually missing was the implementation. The rollout that had been identified, the guidelines that existed, they just weren't being there was no action being done on them. So that's how we actually came into it. All we are doing is implementing exactly what the guidelines say. But we're just making sure that it's done systematically, it goes into process, then it is sustainable so that the process actually just does its job, basically. So that's how we built this whole thing in. And there are no pathways. So when we got started, we knew that this has been identified and it has all the elements in place, but there is no connection of the dots, which is where we are trying to create that pathway.
Yeah, so I think you rightly emphasize the fact that we can have very good policies and strategies, but the road to actioning them or implementing them is really very long and complex and also daunting. So Capid, therefore, is very focused on implementation. But would you really speak to us about what were some of the biggest barriers as you started to take policy to implementation level? And what were some of the biggest lessons that you learned with your work? Are you excited about the newly formed Cervical Cancer Elimination Consortium in India? And how do you think it will help build further momentum towards what you have already started so beautifully?
I think the biggest barrier when we started was awareness. It was like all stakeholders, even for us to raise funds, we had to actually talk to people about what cervical cancer is, its preventable, screening, awareness. Nobody wants to fund you for awareness. I mean, there is just nothing for them to see in that, right? So raising from creating stakeholder awareness, even decision makers in the government, for them, creating that awareness, and then community. It was completely, nobody had heard about it. We were going in to talk about cancer. If in India, we have this concept about don't talk about anything bad, it'll happen. So nobody wants to talk about cancer. We had to actually build that trust in community. We had to get them to believe in us. And then we had to create a model where they would come and be screened. So it was a real journey. And at one time, we used to say the lack of awareness is the biggest burden to the country. That was our problem statement when we started, because we recognized that it's the biggest barrier. And now, of course, because of the global movement, there are people talking about cervical cancer. So it's becoming a little easier to get started. And with COVID and this whole viral thing and the vaccination and all of that, we just piggyback on the COVID now and say it's similar kind of a bad. So that was our largest barrier, definitely. And our learning, I think you asked. So our learning is definitely, Anuradha, that nobody can do this alone. It has to be a collaborative model. People on all different areas of this journey have to come together. Even the government cannot do it alone. There will be a point where they are going to need support in getting to that last mile. So collaboration, we've got to find models of collaboration, which is why I'm very, very hopeful with the Cervical Cancer Elimination Consortium that we have created. It's a collaborative model, and it's people working in different areas of the journey, right? That is going to be a real strength, because in an NGO, you just do what your core job is and you don't have the bandwidth for all the other things. And that consortium has got all the different elements of the journey. So I am really hopeful. Also, the consortium they understand that there are the vaccination and the screening, and it's a whole continuum of care. And then the women need to be navigated. Otherwise, we're just leaving it incomplete, right? So they understand that entire continuum and they're working. Everybody you work with is working on some part of the journey. This is putting it all together, and they are action-oriented. I mean, again, policy, we need to expand and we need to upgrade policies, yes. But to think that policy is the job done, it's not. It's not even half done. Having it in a policy is just starting the journey, the rest of the journey, which is what the consortium is looking at. They're looking at being on the journey and having proof of concept, which I think I have a lot of hope for it, yes.
Yeah, it was so refreshing for me to sit there for 2 days around the table and really listen to so many diverse perspectives and learnings, that are coming out of the work that people are doing. Wonderful work. But as you rightly said, it's such a big leap that we are looking at, because when you highlighted that screening rates at this point are less than 3%, and somebody else said it's actually 2%, then I think the real question is, how do you jump from 2% VI screening rate to 70% HPV and the screening death at rates, and what will it take to make that happen? So coming back to the issue that we discussed, that we can have all these big, nice strategies and plans, but really the question is, what will it take to make that happen on the ground? So, yeah. So, Mridu, you spoke about the transdisciplinary nature of the collaborations that are needed to tackle a challenge like cervical cancer, because we are talking about not just vaccination, which is primary prevention, but also the need to think about a continuum of care to prevent cervical cancer, which then includes a secondary prevention as well. So Capid has been among the first members of the global HPV consortium that we actually conceptualized as a transdisciplinary collaboration of diverse players. So has been part of the global HPV consortium help Capid in any manner?
Oh, absolutely. In fact, I was speaking to somebody just before this about that very thing, that, in India, because we are so large and because, everybody's funding is limited. So you're working in a particular area, on a particular geography or wherever, you may be working on the same thing, but we just don't hear about each other. Everyone is working in silos. So when we had the consortium coming in, and all of you promoting activities of your partners, talking about it, because of the connections, especially on social media, there were so many who heard about us in the country who were doing similar things, and they reached out to you or they reached out to us and they said, we are also doing it. How do we join? What do we do? And in fact, all your partners, the ones who had joined the consortium, we have been able to create projects or create support for each other even within the consortium. So I just think the very level of knowledge and the level of sharing that has come out with the consortium in the last 6 months. In fact, I think we sent you a mail to say there are 4 partners within the consortium that we are talking about doing different things with, a vaccine, data, and multiple things. So this wouldn't have been possible if we were just focused with those blinders going on doing our work, maybe doing very good work, but you don't see the bigger picture till somebody comes in and helps you see that bigger picture. So the fact that the consortium came when it did, and in the last 6-7 months, we have been able to bridge those gaps and, get support through that continuum, meet new people within the country, which was the most surprising. So that has been a big boost through the Global HPV Consortium. That's a big boost.
It's so nice to hear you speak about this, Mridu, because when we conceptualized the Global HPV Consortium, the whole idea was for the consortium to be a unifier, right? Where we start to spark, I would say, new connections, new conversations, new collaborations. And I'm so pleased to really hear you almost vindicate that thinking to say, okay, this consortium is actually succeeding in creating that space or collaborative space where people are saying, oh, we are doing very good work, but others are also doing, good work. And how do we multiply the impact of the work that people are doing, by joining hands. And there is just so much of scope for collaboration in cervical cancer, because as you also said, people can be very focused on the work that they're doing, but that can still be limited and quite narrow in scope. But once you start to see the big picture and other elements that are also equally important, that can help create a much bigger vision and a much more powerful collective effort. My last question to you, Mridu, is that cervical cancer elimination, we all know, is a very audacious global goal. What do you think about countries' readiness? Are countries ready? You are based in India. You are all the time interacting with communities, and based on your own experience, where you're trying to create cervical cancer-free districts in India, what do you think is needed to really make it happen? Realize this whole audacious goal of cervical cancer elimination globally.
So I definitely think countries are ready in the sense that they are aware of it and they know that it can be prevented. And they know they have strategies to prevent it. So there is a kind of support, right? We are very far away from where we were in 2014 when we started talking about it. So I can actually feel the difference in the readiness that people are talking, corporate are talking, doctors are talking, everybody is talking about it, and they're all talking about the HPV. And I'm sure governments will sign their pledges and they will definitely create their policies and all of that. Till then, I have faith that it will happen. What will be the uptake of it? Will it translate to actually saving women's lives, and how many lives will we be able to save? That's going to still be a journey. So countries are ready, people are ready. It's all there. But how are we going to bridge that, and how are we actually going to save? Because these are preventable deaths. We should be completely unreasonable about this. There is no reason. And if to say that the only reason they are dying is because they don't know that they can survive is the saddest thing. It's like saying that your chances of living are less than mine because you don't know something that I know. So that is very unfortunate. So I think that journey for us to do has to be collaborative. There have to be smaller strategies, bite-sized strategies to bring it in that can then create the momentum to be able to achieve the uptake to elimination. The vaccine is a good idea. So instead of now saying that for the next 70 years, we're going to keep doing this, we can say that for the next 30 years, we're going to have to really be concentrated, and then we can start to look at change. So the vaccine coming in, definitely making sure that we tell everybody the entire continuum. Like when you are bringing in the vaccine, it's not the same as getting an MMR or getting a BCG you've done it in your childhood and it's over. You don't even need to know what that vaccine was for. This is a vaccine that I don't agree with that opportunistic model that they've come, just give it to them or just screen them and let them go. We have to educate. At every chance, we have to tell them that this requires 2 screenings in your adult life. Everybody. And then, yes, maybe in 30 years, we can say that we have traveled a particular journey and we will see that we are saving lives. But that's going to be a process.
So thank you, Mridu. Thank you so much for speaking to us and really sharing your insights and perspectives, which are very grounded in reality to our audience. And if I were to try and recap the key messages that you have shared with us today, one, yes, cervical cancer elimination is a daunting goal, but it can be achieved, and it must be achieved because the fact that every 90 seconds, a woman is dying of cervical cancer is just unacceptable when we know that these deaths are absolutely preventable. But the second thing is that the baseline from which we are starting is actually low. Awareness is low, awareness at all levels, not just among women and communities, but also at the government level. So there is a lot of education to be done and a lot of awareness to be built. And underestimating the importance of that first essential step will be very risky. The third is, as you rightly said, integration and thinking about a continuum of care where we absolutely emphasize the importance of vaccination, but also underscore the fact that with vaccination, screening protocols are so important, but also universalizing the provision of screening, regular screening for women at least 2 times, and then making sure that we have a provision of treatment of precancerous lesions, because if women are screened, but there are no services for treatment of precancerous lesion, then also this will just evoke fear and skepticism and cynicism and impact the uptake of screening services. And then finally, the message, which is so precious that you shared with us, is about collaboration, that there is no single entity that can do it alone or by themselves. People have to come together. It is the communities, it is CSOs, it is NGOs, it is governments, but it is also actors and institutions from a diverse range of disciplines, organizations that are working in HIV space, that are working on non-communicable diseases, that are working in cervical cancer space, that are working on vaccination, immunization, youth and adolescents empowerment, women empowerment, reproductive maternal newborn child health, as we keep saying. So really diverse disciplines, and we have to bring organizations together to really make this beautiful goal into reality. So Mridu, any last word to share with my audience before we conclude?
The fact that India carries one of the largest burdens of cervical cancer deaths in the world is not a data point that we should be moving with. And if we have got to eliminate it, we need to create momentum. We need to get people in. Everybody can be an ambassador for this. You don't really need to be doing something or be in the space. Everybody can be talking about it. So we need to get people together. We need to create momentum in the country. All kinds, like you were saying, from every walk of life. If you know about it, talk about it. So everybody becomes an ambassador for it, and then we can look at saving lives.
Lovely. Know about it, talk about it. Let's make everybody an ambassador of cervical cancer elimination. Thank you, Mridu. Thank you.
Thank you, Anuradha.
Bye.